Leg pain is a common yet often underestimated condition that can significantly impact daily life. As an experienced physician, I have encountered countless patients struggling with leg discomfort, ranging from mild aches to debilitating pain that hinders movement. Understanding the root causes of leg pain is crucial for effective treatment and long-term relief. The origins of leg pain vary widely, encompassing mechanical issues, vascular disorders, neurological conditions, and systemic diseases. Injuries such as fractures, sprains, and muscle strains are frequent culprits, often resulting from accidents, sports activities, or overuse. Imagine a marathon runner experiencing a sharp pain in the calf due to muscle overuse, or an elderly individual suffering from a hip fracture after a minor fall. Both scenarios illustrate the mechanical causes of leg pain. Beyond injuries, vascular conditions play a significant role in leg discomfort. Varicose veins, often appearing as twisted, swollen veins beneath the skin, can cause aching and a heavy sensation in the legs. More concerning is deep vein thrombosis (DVT), where a blood clot forms in a deep vein, potentially leading to life-threatening complications like pulmonary embolism. Peripheral artery disease (PAD) is another vascular issue where narrowed arteries restrict blood flow to the legs, causing pain during walking and increasing the risk of serious cardiovascular events. Patients with PAD often describe a cramping sensation in their calves that worsens with activity but improves with rest. Neurological conditions also contribute to leg pain, with sciatica being one of the most well-known examples. This occurs when the sciatic nerve, running from the lower back down to the legs, becomes compressed or irritated, leading to shooting pain, numbness, or tingling. Diabetic neuropathy, a complication of diabetes, can cause burning pain and loss of sensation in the legs, increasing the risk of unnoticed injuries and infections. A patient with diabetic neuropathy might not feel a small cut on their foot, which could later develop into a severe infection requiring medical intervention. Other factors such as arthritis, osteoporosis, and infections can also lead to chronic leg pain. Arthritis, particularly osteoarthritis and rheumatoid arthritis, can cause joint pain and stiffness, making movement difficult. Osteoporosis weakens bones, making them more prone to fractures, which can result in prolonged pain and reduced mobility. Infections, whether in the skin, muscles, or bones, can cause severe pain, swelling, and redness, necessitating prompt medical attention. Recognizing the symptoms associated with leg pain is essential for timely intervention. Persistent aching, sharp stabbing pain, swelling, redness, and difficulty moving the leg should not be ignored. If symptoms such as sudden swelling, intense pain, open wounds, or fever accompany leg pain, seeking immediate medical attention is crucial. Effective treatment options range from home remedies like rest, ice application, and elevation to medical interventions such as pain relievers, physical therapy, and, in severe cases, surgical procedures. Preventive measures, including maintaining a healthy weight, engaging in regular exercise, wearing supportive footwear, and managing underlying health conditions, can help minimize the risk of leg pain and improve overall leg health. By understanding the various causes and available treatments, individuals can take proactive steps to alleviate discomfort and maintain an active, pain-free lifestyle. Leg pain is a multifaceted issue influenced by various underlying causes, each contributing to discomfort in different ways. From mechanical injuries to vascular complications, neurological disorders, and systemic diseases, understanding the root of leg pain requires a deep dive into the mechanisms behind each condition. Mechanical causes of leg pain are among the most frequent culprits. Trauma-related injuries such as fractures, sprains, and ligament tears can lead to acute pain, swelling, and limited mobility. A fractured tibia, for instance, results in severe pain and an inability to bear weight, often requiring surgical intervention. Sprains, particularly in the ankle, can occur from simple missteps, leading to ligament damage and weeks of recovery. Athletes are particularly prone to muscle strains due to overuse or improper technique. A soccer player, for example, may experience a hamstring strain from sudden acceleration, causing sharp pain and stiffness. Herniated discs further complicate mechanical causes by compressing spinal nerves, leading to radiating pain down the legs. Patients with sciatica often report sharp, shooting pain that worsens with prolonged sitting or certain movements. Vascular issues present another significant category contributing to leg pain. Chronic venous insufficiency, commonly seen in varicose veins, arises when weakened vein valves cause blood to pool, leading to aching, heaviness, and swelling. A middle-aged office worker who sits for prolonged hours may develop such symptoms, requiring compression therapy and lifestyle modifications. Deep vein thrombosis (DVT) is a far more serious condition, where a blood clot forms in a deep vein, causing redness, warmth, and significant pain. This condition carries a high risk of pulmonary embolism, making early diagnosis critical. Peripheral artery disease (PAD), characterized by narrowed arteries reducing blood supply to the legs, leads to claudication, pain induced by walking and relieved by rest. A retired smoker with PAD might struggle to walk short distances without experiencing cramping in the calves, highlighting the impact of circulatory insufficiency. Neurological conditions also play a major role in leg pain. Sciatic nerve compression results in pain extending from the lower back to the feet, often due to spinal disc degeneration or injury. Patients with sciatica describe an electric-like pain running down the leg, sometimes accompanied by numbness or weakness. Peripheral neuropathy, frequently associated with diabetes, damages the nerves supplying the legs, leading to tingling, burning pain, and sensory loss. A diabetic patient with poorly controlled blood sugar may initially feel mild tingling in the feet, which can progress to severe pain and even ulcers due to unnoticed injuries. Systemic conditions such as arthritis and osteoporosis contribute significantly to chronic leg pain. Osteoarthritis, caused by joint cartilage degeneration, leads to stiffness and pain, particularly in the knees and hips. An elderly individual with knee osteoarthritis may find it difficult to climb stairs, experiencing worsening pain with activity. Osteoporosis, which weakens bones and increases fracture risk, can cause persistent discomfort even from minor stress fractures. Infections such as cellulitis or osteomyelitis introduce another layer of complexity, often presenting with redness, swelling, and deep, throbbing pain. A patient with an infected wound may develop escalating pain, requiring antibiotic treatment or surgical intervention to prevent severe complications. The diverse causes of leg pain necessitate thorough evaluation and targeted management to ensure effective relief and prevention of further complications. Leg pain is a multifaceted issue influenced by various underlying causes, each contributing to discomfort in different ways. From mechanical injuries to vascular complications, neurological disorders, and systemic diseases, understanding the root of leg pain requires a deep dive into the mechanisms behind each condition. Mechanical causes of leg pain are among the most frequent culprits. Trauma-related injuries such as fractures, sprains, and ligament tears can lead to acute pain, swelling, and limited mobility. A fractured tibia, for instance, results in severe pain and an inability to bear weight, often requiring surgical intervention. Sprains, particularly in the ankle, can occur from simple missteps, leading to ligament damage and weeks of recovery. Athletes are particularly prone to muscle strains due to overuse or improper technique. A soccer player, for example, may experience a hamstring strain from sudden acceleration, causing sharp pain and stiffness. Herniated discs further complicate mechanical causes by compressing spinal nerves, leading to radiating pain down the legs. Patients with sciatica often report sharp, shooting pain that worsens with prolonged sitting or certain movements. Vascular issues present another significant category contributing to leg pain. Chronic venous insufficiency, commonly seen in varicose veins, arises when weakened vein valves cause blood to pool, leading to aching, heaviness, and swelling. A middle-aged office worker who sits for prolonged hours may develop such symptoms, requiring compression therapy and lifestyle modifications. Deep vein thrombosis (DVT) is a far more serious condition, where a blood clot forms in a deep vein, causing redness, warmth, and significant pain. This condition carries a high risk of pulmonary embolism, making early diagnosis critical. Peripheral artery disease (PAD), characterized by narrowed arteries reducing blood supply to the legs, leads to claudication, pain induced by walking and relieved by rest. A retired smoker with PAD might struggle to walk short distances without experiencing cramping in the calves, highlighting the impact of circulatory insufficiency. Neurological conditions also play a major role in leg pain. Sciatic nerve compression results in pain extending from the lower back to the feet, often due to spinal disc degeneration or injury. Patients with sciatica describe an electric-like pain running down the leg, sometimes accompanied by numbness or weakness. Peripheral neuropathy, frequently associated with diabetes, damages the nerves supplying the legs, leading to tingling, burning pain, and sensory loss. A diabetic patient with poorly controlled blood sugar may initially feel mild tingling in the feet, which can progress to severe pain and even ulcers due to unnoticed injuries. Systemic conditions such as arthritis and osteoporosis contribute significantly to chronic leg pain. Osteoarthritis, caused by joint cartilage degeneration, leads to stiffness and pain, particularly in the knees and hips. An elderly individual with knee osteoarthritis may find it difficult to climb stairs, experiencing worsening pain with activity. Osteoporosis, which weakens bones and increases fracture risk, can cause persistent discomfort even from minor stress fractures. Infections such as cellulitis or osteomyelitis introduce another layer of complexity, often presenting with redness, swelling, and deep, throbbing pain. A patient with an infected wound may develop escalating pain, requiring antibiotic treatment or surgical intervention to prevent severe complications. The diverse causes of leg pain necessitate thorough evaluation and targeted management to ensure effective relief and prevention of further complications. Recognizing the need for medical attention is crucial in preventing severe complications associated with leg pain. Severe pain that does not subside even with rest may indicate an underlying issue requiring immediate intervention. A patient experiencing persistent, unrelenting pain that interferes with daily activities should seek professional evaluation. Pain that worsens at night or remains unaffected by changes in position can suggest conditions such as deep vein thrombosis, severe nerve compression, or a progressing infection. Ignoring these symptoms may lead to irreversible damage or life-threatening consequences. Sudden swelling in the leg, especially when accompanied by sharp pain, requires urgent medical assessment. This symptom may signal a vascular obstruction such as deep vein thrombosis, where a clot impairs circulation and increases the risk of pulmonary embolism. A traveler returning from a long-haul flight may notice one leg becoming swollen, warm, and painful, a classic sign of DVT. Immediate diagnosis and anticoagulant therapy are essential to prevent the clot from dislodging and traveling to the lungs, which could result in a fatal outcome. Similarly, unexplained swelling accompanied by discoloration may suggest a progressing infection or an inflammatory condition that necessitates targeted treatment. Non-healing wounds or ulcers on the legs serve as a critical warning sign, particularly in individuals with diabetes or peripheral artery disease. A small, seemingly insignificant cut on the foot of a diabetic patient can evolve into a chronic ulcer due to impaired circulation and reduced immune response. Such wounds may become infected, leading to deep tissue damage and, in extreme cases, amputation. A patient with PAD may develop ulcers around the ankles or toes that fail to heal, indicating severe arterial insufficiency requiring vascular intervention. Early detection and proper wound care can prevent severe complications and improve outcomes significantly. Fever accompanied by leg pain is a concerning symptom that should not be overlooked. Systemic infections such as cellulitis, osteomyelitis, or septic arthritis can manifest with localized pain, redness, and swelling, progressing to fever and chills as the infection spreads. A patient presenting with a high fever and an extremely tender, swollen leg may be suffering from a bacterial infection that requires immediate antibiotic therapy. In cases where the infection reaches the bloodstream, sepsis can occur, posing a life-threatening emergency. Timely medical intervention is essential in preventing the escalation of such conditions. Persistent leg pain lasting more than 2 weeks without improvement necessitates medical evaluation to determine the underlying cause. Chronic pain that does not respond to rest or home remedies may indicate structural damage, vascular insufficiency, or an inflammatory disorder. A construction worker experiencing ongoing knee pain despite reduced physical activity may be suffering from early-stage osteoarthritis. A patient with persistent calf pain that worsens with exertion but subsides with rest could be exhibiting signs of peripheral artery disease. Identifying the root cause through diagnostic imaging, laboratory tests, and clinical assessment allows for tailored treatment strategies aimed at long-term relief and improved quality of life. Treating leg pain effectively requires a thorough understanding of the underlying causes and the most appropriate therapeutic interventions. The severity and nature of leg pain can vary widely, from mild muscle fatigue to severe neuropathic pain, vascular disorders, or orthopedic injuries. Understanding and addressing the root cause is essential for effective treatment. Home care strategies serve as the first line of defense, particularly in cases where the pain results from overuse, minor injuries, or muscle strain. Rest is one of the fundamental components of managing leg pain at home. It allows injured tissues to heal, prevents further damage, and reduces inflammation. For individuals experiencing acute pain following physical exertion, temporarily avoiding activities that exacerbate discomfort is crucial. Ice and heat therapy are also widely used in home care treatment. Ice application constricts blood vessels, reducing swelling and numbing pain, which is particularly beneficial for acute injuries such as sprains or muscle tears. On the other hand, heat therapy dilates blood vessels, improves circulation, and relaxes tense muscles, making it more suitable for chronic conditions such as arthritis or muscle stiffness. Elevating the affected leg is another effective self-care measure. By raising the leg above heart level, blood flow is redirected, reducing swelling and promoting venous return. This technique is particularly beneficial for individuals suffering from venous insufficiency or those who experience leg swelling due to prolonged standing. Gentle massage is another non-invasive intervention that can help alleviate discomfort. It improves circulation, relieves muscle tightness, and promotes relaxation. However, massage should be performed cautiously, as excessive pressure may worsen certain conditions such as deep vein thrombosis or fractures. Pharmacological treatment options play a crucial role in managing leg pain, particularly when self-care measures are insufficient. Over-the-counter analgesics, such as paracetamol, provide effective pain relief for mild to moderate discomfort. Nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen are beneficial for reducing inflammation associated with conditions such as tendinitis, arthritis, or muscle strains. In cases of severe muscle spasms, muscle relaxants such as cyclobenzaprine or baclofen may be prescribed. These medications work by inhibiting nerve signals that cause involuntary muscle contractions, thereby reducing discomfort and promoting mobility. For individuals with neuropathic pain resulting from conditions like diabetic neuropathy, medications such as gabapentin or pregabalin may be necessary to regulate nerve activity and alleviate pain. Patients with vascular-related leg pain, such as deep vein thrombosis, may require anticoagulants like warfarin or rivaroxaban to prevent clot formation and improve circulation. Physical therapy is another cornerstone of leg pain management. Tailored exercise programs aim to restore strength, flexibility, and mobility while minimizing the risk of re-injury. Stretching exercises help maintain muscle elasticity and prevent stiffness, particularly in individuals recovering from muscle strains or undergoing rehabilitation for orthopedic injuries. Strengthening exercises focus on stabilizing the affected limb and supporting surrounding structures. For example, quadriceps strengthening exercises benefit individuals with knee pain, while calf raises help those recovering from Achilles tendon injuries. Modalities such as electrical stimulation are often used in physical therapy to reduce pain, improve muscle activation, and promote tissue healing. Additionally, ultrasound therapy utilizes sound waves to generate heat and improve blood circulation, enhancing the healing process in conditions like tendinitis or ligament injuries. In more severe cases, when conservative treatments fail to provide adequate relief, surgical intervention may be necessary. Surgery is typically reserved for structural abnormalities, severe injuries, or vascular conditions that compromise blood flow. For instance, patients with herniated discs that compress spinal nerves and cause radiating leg pain may require surgical decompression procedures such as laminectomy or discectomy. Similarly, individuals with significant arterial blockages due to peripheral artery disease may benefit from angioplasty or bypass surgery to restore proper circulation. Trauma-related injuries, including fractures or ligament tears, often necessitate surgical repair to realign bones, stabilize joints, and restore functional integrity. Ultimately, the most effective treatment for leg pain depends on an accurate diagnosis and a comprehensive approach tailored to the individual's needs. A combination of home care, medication, physical therapy, and, when necessary, surgical intervention ensures optimal recovery and long-term pain relief. Preventing leg pain requires a multifaceted approach that encompasses lifestyle modifications, physical activity, proper footwear, and medical management of underlying health conditions. Maintaining a healthy weight is one of the most critical aspects of leg pain prevention. Excess weight places additional strain on the lower extremities, leading to joint wear and tear, muscle fatigue, and an increased risk of developing conditions such as osteoarthritis. For instance, individuals who are overweight are more likely to experience knee pain due to the excessive pressure exerted on the joint cartilage. Studies have shown that even a modest weight reduction can significantly alleviate discomfort in weight-bearing joints, reducing the likelihood of chronic pain development. Furthermore, obesity is linked to metabolic disorders that can indirectly contribute to leg pain by impairing circulation and increasing systemic inflammation. Regular physical activity plays a crucial role in maintaining leg health by enhancing muscle strength, improving circulation, and promoting joint flexibility. Exercises that emphasize stretching help maintain the elasticity of tendons and muscles, reducing the risk of strain injuries. For example, individuals who engage in yoga or Pilates often experience improved lower limb flexibility and a decreased incidence of muscle stiffness. Strength training, particularly focusing on the quadriceps and calf muscles, provides support to the knee and ankle joints, reducing the likelihood of injury. Additionally, cardiovascular exercises such as walking, cycling, or swimming enhance blood circulation, preventing venous insufficiency that can lead to conditions such as varicose veins or deep vein thrombosis. People who remain sedentary for prolonged periods, especially those with desk jobs, should incorporate movement breaks to prevent leg stiffness and poor circulation. Choosing appropriate footwear is another vital component of leg pain prevention. Shoes that provide adequate arch support and cushioning help distribute body weight evenly across the feet, minimizing stress on the ankles, knees, and hips. High heels, for example, shift the body's center of gravity forward, leading to an unnatural posture that places excessive strain on the lower limbs. Over time, this can result in conditions such as Achilles tendonitis or metatarsalgia. People with flat feet or high arches should opt for orthopedic shoes or insoles that offer additional support. Athletes, particularly runners, should ensure they wear shoes with proper shock absorption to prevent impact-related injuries such as shin splints. Wearing the wrong footwear can lead to biomechanical imbalances that contribute to chronic leg pain and discomfort. Managing underlying medical conditions is essential for preventing leg pain, particularly in individuals with diabetes or hypertension. Diabetes can cause peripheral neuropathy, a condition that results in nerve damage and leads to symptoms such as numbness, tingling, and pain in the legs. Proper blood sugar control through diet, medication, and exercise can prevent or slow the progression of this condition. Similarly, hypertension affects circulation, increasing the risk of peripheral artery disease, which can cause leg cramps and discomfort during physical activity. Patients with these conditions should work closely with healthcare providers to manage their symptoms effectively. Regular checkups, medication adherence, and lifestyle modifications can significantly reduce the risk of complications that lead to leg pain. By taking proactive steps, individuals can maintain optimal leg health and prevent discomfort associated with various musculoskeletal and vascular conditions. Leg pain is a condition that should never be ignored, as it can stem from a variety of underlying causes, ranging from minor muscle strains to serious vascular or neurological disorders. Understanding the root of the pain is essential for determining the most effective treatment approach. Whether caused by mechanical injuries, circulatory problems, nerve compression, or systemic conditions like arthritis or osteoporosis, each case requires careful evaluation to prevent complications and ensure optimal recovery. Early recognition of symptoms such as persistent pain, swelling, weakness, or numbness is key to avoiding severe consequences, including mobility issues and long-term disability. For those experiencing mild discomfort due to overuse or strain, self-care strategies such as rest, ice therapy, elevation, and gentle massage can provide significant relief. However, when pain becomes chronic, worsens over time, or is accompanied by alarming signs like sudden swelling, wounds that do not heal, or signs of infection, seeking medical advice becomes imperative. Left untreated, conditions such as deep vein thrombosis or peripheral artery disease could escalate into life-threatening complications, including pulmonary embolism or severe circulatory failure. Medication plays a crucial role in pain management, with options ranging from over-the-counter analgesics like ibuprofen and acetaminophen to prescription-based muscle relaxants and anti-inflammatory drugs. In cases involving nerve pain or vascular disease, more specialized treatments may be necessary, such as blood thinners, neuropathic pain relievers, or even surgical intervention to restore proper function. Physical therapy is another cornerstone of leg pain treatment, as guided exercises and advanced techniques like ultrasound therapy or electrical stimulation can promote healing, strengthen muscles, and improve circulation. For individuals facing severe structural damage, whether due to herniated discs, arterial blockages, or complex fractures, surgical procedures may be the only viable solution. While surgery is often considered a last resort, advancements in medical technology have made many operations minimally invasive, reducing recovery time and improving long-term outcomes. From spinal decompression procedures to bypass surgeries for vascular obstruction, these interventions can significantly improve quality of life when conservative methods fail to deliver relief. Prevention remains the best strategy in managing leg pain. Maintaining a healthy weight, staying physically active with regular stretching and strengthening exercises, and wearing supportive footwear can reduce strain on the lower limbs and joints. Managing chronic health conditions such as diabetes and hypertension is equally crucial, as these diseases can contribute to nerve damage, poor circulation, and increased risk of complications. For those in high-risk groups, routine checkups and early intervention can prevent minor discomfort from evolving into a debilitating condition. In the pursuit of long-term leg health, a proactive approach combining preventive measures, early diagnosis, and appropriate treatment is the key to maintaining mobility and overall well-being. Anyone experiencing persistent or severe leg pain should seek medical evaluation to identify the cause and implement the most effective treatment plan. Addressing the issue promptly can prevent future complications and help individuals regain comfort, strength, and confidence in their daily activities.